It is now October 6th of 2020. And as of today, we have 3,711 cases, 51 deaths. We now have 9 people in the hospital, including 3 in the ICU. We have 1,500 of those current active cases that are basically home, not hospitalized, and 2,138 recovered. That gives us a case fatality rate of 1.4%. And then the monitoring is basically related to close contacts and other things, either being Trace Force is basically a state contract force of people that are assigned to and working with each county, and then the others that are monitoring are being monitored by our own staff. So this is what our hospitalization chart looks like again. As you know, for a long time here, we were hanging in this under 5 number. We bounced up here the end of August, early September, and then made a nice progress back down again. But now we're having another surge in hospitalizations. So well, I wouldn't say surge. We have an uptick, I should say, in hospitalization. So let me correct that for the record. A little bit of an uptick here in the last few days in hospitalizations since last week. So right now we have 40.8% of our cases at home, 0.2% hospitalized, 0.1% in the ICU, 57.6% recovered, and 1.4% deceased. So our current cumulative curve looks like this. So once again, we're doing a lot of work and leveling off what was, an upsurge in cases. So that is starting to level off. When we look at our incidence curve, it now looks like this. So you can see that basically the month of September was certainly challenging for us. And we do have, in addition to, what I've mentioned before, which was some indication that testing was a problem, really also true information that we indeed are getting case counts down. Just a matter of how much of that is really down and how much of it still may be related to testing. The testing numbers have been holding fairly steady for the last couple of weeks. So our percent positivity per day did get above 5%. And is back down now below 5%. Our goal is to get under 3%. And I think I looked at the My Start map today, and we might have been about 3.2%. So we're back down to getting close to an indicator there that we should feel comfortable with in terms of transmission in the community. When we look at the rolling averages of all of those things, and I explained to you last week, this giant positivity number out here had to do with the fact that there was very little testing going on. And what testing was going on was mostly in seriously ill patients and those sorts of things. So when we were testing, the vast majority of the time, it was because of a very likely positive and a very likely serious illness because of the limit of testing at the time. Once testing capacity got good and strong, we've managed down here in this, less than 5%, mostly, in the 2 to 3% range, until our recent uptick in cases where, on a rolling average basis, even we got above 6% for a little bit there and are trending back down. So when we look at cases by zip code, we now have 1,541 to 1,550 of our cases in 48823. And then that is followed by 48911 that we talked about a lot earlier in the epidemic. So I'm not even going to show you the case map anymore. We're just going to go straight to a rate map. I've been showing you 2 maps in a row. You're probably getting bored of that. Rates is the best way to look at things, and we have enough zip codes with the ability to calculate rates to focus in on that. So we do see that the East Lansing zip code is the zip code with the highest rate in the 1,310 to 2,652 range, followed by Lansing 48911, and another Lansing zip code in here. You'd think I'd learn my Lansing zip codes. This is 48910, so it's not 48910. This, I believe, is 4890, the airport. So this is maybe 15 and 12, somewhere in there. If you look at kind of a really, bird's eye view of our county heat map, we now look like this because of the predominance of cases in the 48823 area. So when we look at a more zoomed in version that you are accustomed to looking at, again, the heat of what's going on over here makes what was happening in 48911 look a little fainter, but you can still see the clusters that we had in 48911 as well as up here. But you do see this significant number of cases in 48823. We can zoom in a little bit and look at that, and you can see, a few other than just the downtown area here right across from campus. This is, somebody's going to be able to tell me what this is, Water's Edge or something like that area in here. This is, I believe, Skyview out here. This is Hannah Lofts over here. This may be a testing artifact right here, trying to look into that. And then there's a few other apartment complexes, clearly one in here, and something a little bit in here that are also areas where we have quite a number of cases. When you look at what's going on really in the East Lansing area, and like I said, we do have this little bit in this zip code within Lansing. It's just outside of the East Lansing area. When we look at our cases by sex, we are currently still 50% female, 50% male. When we look by age group, we are 20% now, 10 to 19, which is, I believe, where we were last week, and 42% 20 to 29. And then all other age groups certainly significantly below that. I did promise you a breakdown of that. So if you look at that 10 to 19 age group, the 10 to 17-year-olds are 3% of that 20%. The 18 and 19-year-olds are 17%. If you look in the 20 to 29 age group, 36% of that 42% are 20 to 24, and 6% are 25 to 29. So if you look at an 18 to 24-year-old age group within the totality of all of our cases since March, 53% of those now are 18 to 24 years old. When we look at our cases by race, 67% are Caucasian, 14% Black or African American, 6% Asian, 11% other, 2% unknown. So when we put this on a prevalence rate graph now, the Caucasian to African American rate is a little less than 1.4 times. So African Americans 1.4 times more likely to have COVID in this county than Caucasians. And the rates between Asians and Caucasians have now leveled out to where they're essentially the same. When we look by ethnicity, 83.8% are not Hispanic or Latino, 7.7% Hispanic or Latino, and the rest unknown. Again, by rate, 1,152 are not Hispanic or Latino, 1,240 Hispanic or Latino. So very slight and yet still difference in prevalence between these ethnicity groups. When we look at our deaths by age, we still continue to, we're up to 51 deaths now, so we will continue to update these charts. 45.1% are over the age of 80, and then 33.3% are 70 to 79. And then after that, we are at 11.8%, 60 to 69, 7.8%, 50 to 59, and 2%, 40 to 49. So just to help you on the quick math on that, that's 78.4% of our deaths are over the age of 70. And then, of course, you do see that increase in prevalence then when you get into the over 80 group. When we look at deaths, 51% are male, 49% are female. When we look at those by race, 29.4% are African American, 64.7% Caucasian, 3.9% other, 2% unknown. So given that our population is 11 or 12% African American or Black, this is definitely a disparity here. Again, rate calculations with tiny numbers are very difficult. So we're just going to have to kind of look at that with the lens of knowing that we are a county that does not have a population that is 29 to 30% African American. So there is a disproportionate burden on our African American or Black population in terms of death. When we look by ethnicity, 90.2% are not Hispanic or Latino, 5.9% are Hispanic or Latino, 3.9% other. And I'm going to guess that aligns fairly well with the statistics in the county in terms of distribution of ethnicity. I'd have to look up that ethnicity percent in our county to be sure of that. So on to MSU related cases as we continue to track what's been going on there. Again, you see these numbers nice and flattening back out. We do have some concerns about testing. Like I said, the testing numbers have leveled out to some extent. And as you see here, percent positivity within the MSU information that we have has also been trending downwards now. When you do rolling averages, sometimes you can have a little bit of an uptick, but as soon as you add the next day in, it might, continue downwards. So we definitely do have a nice downward trend in percent positivity since last week, which is a very good thing to start seeing now. So when we put those two together with incidence on a rolling average as well as percent positivity on a rolling average, we do now see this trend coming down, which would indicate cases should be going down. So a combination of probably some lack of testing as well as just plain old hard work getting cases down have brought this really huge surge in cases down fairly rapidly. So basically MSU now reports on Mondays. So we create this chart for them for the most part. I believe they use it almost as is on Mondays. So this reporting should match what you are seeing online for them right now, where we have broken down by weeks, beginning the week of Monday, July 20, on a Monday of July 21st. So then if we look at that cumulative case count now graph where I showed you the cumulative case count for the county, and then this surge in cases, again, we're looking at this kind of parallel, steep curve here, which is now leveling out here and also helping us with some leveling out here, but you'll see that this is leveling out now a little bit more than what we're seeing in the community at large. So that is the end of information I have today. Can you all see me again? Whoops, I lost you. There you are.
Does anyone have any questions for Health Officer Vail? Go ahead, Ben.
Hi, Linda. So two parts to this question. First, in regards to the MSU cases, could we also attribute that to the fact that not all MSU students are in Lansing right now? And also in regards to the Supreme Court ruling on Friday, are you concerned that these case numbers could go up and people will drop their guard?
So those are really two disparate questions. So let me take the first one, which is, remind me.
The first one has to do with, could we also attribute MSU cases to the fact that not all students are in Lansing?
We exclude those.
Okay.
So all of the ones that we're counting on our MSU related counts have been looked at to, one, assure that they are a student or a faculty member. If we don't get, that information comes from them. And then we have been able to verify some of that information with the university as well to make sure that we're controlling this outbreak. If it is an MSU student who is online and not living in the area, we do not count that as an MSU related case in the context of what we're counting right now. So that is not, these are cases that are related to here, not somewhere else, being online, taking classes somewhere else. With regards to the Supreme Court decision, obviously that was pretty stunning at the time. So we did put a number of orders into place that I think fill in some of the major concern gaps And you can see that gradually the state is issuing orders also under the health code, because the state health officer also has authority under the health code to issue certain orders. So those are coming out. A couple more came out today, something related to schools and reporting, and something related to, I think, long-term care facilities. And I would expect, as the legal team at the governor's office continues to review what authority and how these orders can be written in a way, that you'll see more of them come out. But you did see yesterday face coverings be mandated across the state at the state level. We did so far, we have not rescinded our face covering order in Ingham County. And there are a couple of reasons why I'm still thinking about that. We have a gathering order, which pretty much duplicates their gathering order. We do have a restaurant and bar order. The restaurant and bar part of the order that was released yesterday was very minimal. And so the order we have in place is a little bit more instructive in terms of bars and restaurants and how they go about doing things in a way that keep people 6 feet away and safe, and all those things that were in place before, as well as continuing capacity restrictions. And then the last is, we did have an employee screening order in place at the end of March, and just basically pulled that back into place to continue to have employee screening. Yeah, we are concerned basically about what is going to happen now with the ruling and people dropping their guard, and lots of, confusion about whether or not there is any, essential stay. I mean, are we in a 21-day period holding with these orders in effect, or are we not? There's lots of confusion in the air, which is why orders were issued by us this weekend, because, while that debate goes on, we need to make sure that our county is safe and protected. So it is definitely, one, we're waiting for that answer to the governor's question, because she has asked the Supreme Court, when is this officially in effect? So we hope to get an answer to that soon, and then we'll know how long the executive orders do or do not stay in effect. And then we will basically move on from there. So. Thank you. Everybody else is quiet.
Does anyone have a question? Kate?
Hey, Linda. My question is kind of along the same lines. How should we interpret this kind of dramatic fall off in MSU cases? When you look at it, you were saying, it's some combination of good efforts across the board, but also a drop in testing. And when I look at the testing data that MSU is doing on campus, it goes from like 1,000 the week of September 14th to just 2 weeks later, last week, to doing just about a third of that. And that's a pretty rapid drop off. As I'm trying to think through, is this more of what you were concerned about, which is a lack of testing and students being willing to go get tested? Are we seeing data to back that up, or do you think this is actually getting this curve under control?
I think it's some of both, but I think the important metric to look at is that percent positivity. So even if fewer people get tested, if transmission rates are high, in other words, there are lots of cases, you would expect to see a lot of a high percent positivity. In other words, of those going to get tested, a lot are positive. So when you see a lower percent positivity, and we did see that percent positivity start to nicely decline, that does also indicate that we truly are just having a decline in cases. So it's a little bit of a combination of both, but I'll give some really good credit to the fact that we do seem to have a true drop in cases that probably looks a little more accelerated than it might have if there had not been also a drop in testing right at the beginning when we knew case counts were really high. So.
If I can just ask a quick follow-up on that. I mean,
that's my science brain thinking on the spot. I don't have anything I can point proves all of that. You just look at the data, you look at 3 or 4 different sorts of data, which is what scientists do. You triangulate data, you hear, about Facebook posts and comments and things like that, and you kind of put all that together. But I think we're on a very good trend in a very good path right now with what's going on with MSU. That's what I would say.
The percent positivity that you're talking about in terms of MSU here, I'm assuming that you guys are looking at the same ones that is on their website here, which is for last week 10%, which from 2 weeks is I mean, yes, it's better. It's certainly not as drastic of a drop as we're seeing in the testing.
Right, and I have access to testing data beyond that. So that is their own testing that they're doing in their laboratory. And so I also have access to some testing information from outside of that, and I combine those together. So I forget what the number was yesterday, but that's the number you see in our graphs. It's kind of a combination of those things. And so that does start to show me that our percent positivity is definitely dropping.
Go ahead, Rachel Sweet.
Hello, Linda. How are you?
Yes. Hi.
Hi. I know that there's been a lot of talks with the station and you and regarding the new orders that the Ingham County and now that the MDHHS has issued their emergency executive order the other day. What's kind of your thoughts to that? Along with the orders that you guys have in place right now.
Well, my thoughts to that are, like I said, I see some things in those orders that are, not necessarily as they were in the executive orders. I think they were trying to get done what they could do fairly quickly in order to keep from having gaps. And so I don't fault that at all. We were doing the same thing on Sunday, trying to make sure that we quickly covered things that we thought were the most critical gaps. I'm at a point now where because of the back and forth and the anticipation that there will be some criticism or perhaps even accusations that the state health director didn't have the authority to do it, or definitions of contesting definitions of things and things like that, that I would rather keep the orders in place that we have in place in Ingham County right now until things settle down a little bit, rather than rescinding them only to find ourselves back in this place again and needing to reissue them. There's nothing in them that is more lenient than the state, and there's really nothing in there that is significantly stricter than the state either, with the exception of our bar and restaurant order, which does get into capacity restrictions, which if you look at the new order by MDHHS, it doesn't say anything about capacity, just 6 feet distancing and no intermingling in a place where they sell alcohol. It was just like, I didn't know what to say about that. I didn't see any capacity types of restrictions. So we'll keep that in place and continue working with the Michigan Liquor and Beverage Association, the Michigan Restaurant Association, it's Restaurant and Hospitality Association, because I have been in contact with them and received feedback on them regarding where their members are with this. And right now they seem to be fairly confident and good with where we are. I think some of them would like to see that 125 capacity limit either lifted or raised. And that is certainly a possibility. One of the things that I thought when I put that cap on there is that bars and restaurants needed some experience dealing with numbers of people before they had to deal with larger numbers of people. And obviously, last weekend we had a number of issues with some bars and restaurants in East Lansing. So if you're having issues, that certainly is not a way to show to me that it's like, okay, we can handle 125, let us go to 250. It's like, whoa, we're not doing very well with 125. Maybe we should, hold on that. So I will say also that our environmental health team was out in East Lansing over this weekend, late in the evening, and things looked much, much improved. We did pay some visits to them last week, as well as the Responsible Hospitality Council in East Lansing had a meeting to talk to their members. And I think what we saw this weekend was the result of some conversations and some reminders. And from what I hear from my team that was out this weekend, things look pretty good.
At the bars and restaurants, right?
Mm-hmm. Yes.
Okay. And so do you, I always preface it with, I know there's no crystal ball, but do you expect an uptick now that in cases, or it's just kind of, we'll see how things go and how people mask up and keep their distance now that the executive orders are kind of unconstitutional?
Well, the executive orders are unconstitutional. Actually, the law that they were written under was unconstitutional, which makes them null and void, I think, or so, I don't know. Something about it was unconstitutional. I won't go into that. I haven't read the whole Supreme Court decision. But they do have another order in place, which does require essentially social distancing by defining gatherings and gathering sizes and those sorts of things. It also puts in place the mask order, and it also puts in place regulations, and I think a couple of other places. So it's not like we're void of orders that are now in place at the state that are under the public health authority that is not basically being challenged as being unconstitutional. I will also say, and I think this is important to note, because I think you might hear that next, it's like we'll come after the public health code next. The public health code in the state of Michigan has been here for a long time. Public health codes like it have been around for a long time. 2 landmark cases in the Supreme Court have upheld the authority of public health authorities. And those landmark cases that keep getting repeated in terms of supporting the authority of public health are from 1902 and 1906. Almost every health department and health departments in this country have codes. Every state has codes like this that give this kind of authority to public health officials for a reason. And it is to be able to swiftly protect large numbers of people from serious illness, serious disease, and death. And so that health code is not just a Michigan thing that all of a sudden is like, oh, there's this other law that we just determined unconstitutional. Now you found another one, we'll just go after that one too. Every country in this state has got a law like that on the books for a reason.
Okay. And if nobody else has any questions, I'll ask one more.
I think Kristen,
Okay.
who's in this corner for me, had a question earlier. I saw her raising her hand.
All right, I'll come back around. Thank you.
Thanks,
Go,
Linda.
Kristen.
I appreciate it. My question has to do a little bit more with the testing things that Kate was asking about. And it's in regard to why it is that you think that testing has dropped off as it has. Is it because there isn't as much access to testing? Are there fewer tests available? Or are people just not as willing to get tested? What are your thoughts on that?
Okay, so that's actually going back to last week. As I said, right now, I think we're leveling out and we're improving. We're improving on testing numbers. We're improving on testing percent positivity. Cases are dropping, all looking good. Right after the quarantine orders were issued, there was a lot of pushback, and there was a lot of testing numbers dropped off very suddenly at a time when we knew case counts were exceedingly high, which was unusual. And then for percent positivity to be as high as it was and case counts to be dropping anyway, all of that didn't add up. I mean, we've been talking since the beginning of this pandemic that if percent positivity is low and stays low, but case counts go high, then that is just a result of more testing. Well, likewise, if we've got a percent positivity that's maybe higher and yet case counts are just drastically dropping off, that doesn't add up either. So that kind of information is what leads you to that conclusion, or that observation, I should say, that metric, a number of other metrics, just the steepness with which the cases fell off, which from an epidemiologic perspective is rather odd looking. Those kind of things lead you to that kind of observation. Then you add to that anecdotally, Facebook posts, social media posts, just literally claims, out there in the public that, just don't go get tested. So those have been seen and heard and reported to us as well. But again, I think that we are leveling off with that. We're leveling off with, testing. Cases are dropping down. The amount of testing right now might be down truly because cases are down, because percent positivity is down. So that's kind of where I am with it right now. That was my issue last week and the week before, is that I was deeply concerned that people weren't going in for testing. We are seeing an increase in cases in the surrounding community. which is not unexpected either. I believe I did a calculation, and I looked at, I'm going to open up a document. Sorry, I'm looking away. Between August and September, we saw 123% increase in cases in the East Lansing area not associated with MSU. So we went from 44, cases in 48823 in August that were not related to MSU to 98 in September. So that's that 125%, 123% increase. And I want you to think it was huge numbers, but they are, that we are seeing that increase now in the surrounding community. And that seems to be holding true for October, where I'm already looking at the numbers of referrals and cases are exceeding those that I saw in August as well.
Go ahead, Rachel, with your follow-up question.
Thank you. Just a follow up about schools. Has any superintendents or districts reached out to you in regards to how things are going after the MDHHS released their emergency order the other day?
So the emergency order that was released yesterday, or the one that was released today? There was one released.
Oh, yeah, the one today, yeah. But I'm not sure if you spoke to superintendents.
Yeah, they knew that was coming, and I actually spoke to our ISD superintendent about that this morning. I drop in and answer questions on the monthly superintendent's meetings. I have been in, special meetings with them as well. And I have been in numerous conversations with superintendents, as well as invited to some of their meetings or board meetings. And tomorrow we'll be on a meeting that has been called with school board members from a number of different districts via the ISD. So yeah, lots of communication with them. They were confused about what does publish mean. I told them, I said, we did have a meeting about that, and I can tell you, what that means. And then the guidance came out today. But, for them, publishing means, they typically will send out a letter to parents, email or text. And I think all the state is asking for them to do in terms of publishing, at least the last time I was in a conversation about it, is that they might also, for example, put that letter on their website. And that is considered basically the equivalent of publishing for them.
Okay. All right, well, thank you.
I haven't read today's guidance, so hopefully that came out that way. But the last time I was in a meeting talking about it, that's the way it was heading. So.
All right.
I think Brittany has a question.
Thank you.
Hi, yes. I have a couple of questions, but I will ask you first. I guess you mentioned that you're considering the possibility of increasing capacity limits in restaurants. Can you expand a little bit on that, and like what would it take for you to get to that point where you're willing to allow more people inside?
So I think what I said is that I've been working with and have talked to Michigan Liquor Beverage Association and Michigan Restaurant and Hospitality Association, and one of the things they would like to see is that cap either being lifted or being removed. And that my thought behind putting it in place in the first place was to let them gain experience and then increase it. So we went from 75 at one point up to 125. And with the experience we saw certainly in recent past with some restaurants and bars not being able to manage that 125 very well, we're not going to do that, right now. It is definitely not off the table for considering in the future. But that's what we want to see. We want to see restaurants and bars managing the crowds that they have and managing them well. Our experience last weekend with some of the problem spots we saw was much better this last weekend. And if we can continue on that path, then we can continue to look at that. So that's kind of where I am with it right now.
Okay, and then I'm also curious, I know there's still a number of bars in the East Lansing area, the Riv, Rick's, Harper's, that are still closed. Do you see those opening up anytime soon with the Supreme Court ruling, or I don't know I think it's the owner's decision that they're closed, and correct me if I'm wrong, but do you see those bars possibly opening up again?
So I don't know that the Supreme Court ruling has anything to do with it. And we do have a bar and restaurant order still in place in East Lansing, which caps at 50% and does all those other things. And so I did talk to the owner of the Riv and Rick's this morning. You know, really his philosophy has been, he's kind of wanted to sit back and watch others and learn, so that when he does open, he has basically positioned himself to do things in ways that, you know, he's learned lessons from others that have gone before him. So I do think he's considering opening soon. Harper's, likewise, basically has stayed closed of their own choice. I mean, they do have to submit plans to us and all of that sort of stuff for us to go in and do an inspection and reopen, but they needed to request that, and they have not requested that as yet. They're coming close, I believe, to doing that. But they chose to stay closed for the length period that they did on their own. They also chose to stay closed after we had the strongly recommended quarantine order in place for all MSU students in East Lansing. They issued a statement saying that we had planned to open soon, but we're now not going to open until this expires, because we do not want to be enticing people out when basically the strong recommendation is for people to quarantine for 14 days. So the additional delay in their opening came out of respect for the strong recommendation to quarantine in East Lansing for MSU students. So,
Would you be nervous at all about them reopening, or what would it take for you to feel comfortable with that?
you know, they are going to have to abide by the rules that everybody else has to abide by in terms of, you know, people staying seated and bar services, not mingling in dancing areas and things like that. And, you know, they learned a hard lesson, you know, and I expect them to be extraordinarily cautious, quite honestly. In the conversations that I've had with them, they are, you know, every bit and every ounce of caution that they can think of. And then the Michigan Liquor Commission asked for Geraldine Lasher, who's one of the commissioners, to be part of the inspection for them to reopen. We'll do a full inspection. We'll go through all of the things that we expect, you know, special under COVID, as well as the Liquor Commission being there. And so far, you know, they've been on a very good path. And just like any other bar and restaurant, if we get complaints, if we have to deal with issues, we will. But I know from all I can tell, and from all accounts that I have in terms of my interactions with the owners since the close down, is that their intent is to do the right thing, be as careful as possible. They certainly do not want anything like what happened back in June happening again.